Okay, sorry, I forgot to record. So now we'll continue from here again. So we were discussing about the objective. So we will see how to incorporate the clinical knowledge along with safety and kindness. We all are doctor. We know the basic knowledge, clinical knowledge. We all have this clinical knowledge, but we all lack in safety and kindness. They are the specific features that you need to follow. There are certain features in the real exam. The examiners has this page and they have boxes. They tick those boxes if you follow those steps of safety and you show kindness to your patients or with the student. So we will be discussing it with all the when we will discuss the scenarios. We will be discussing what is safe in this scenario and how to show kindness to the student, and how to show the examiner that we are a safe doctor. In the exam, when you will go to the GMC building, the invigilator before the exam will repeat these sentences that we have assessed your PLAB 1, we have assessed your clinical knowledge in PLAB 1. Now we are going to assess either you are a safe doctor and a kind doctor, not. So we will be discussing this, that how we can get maximum marks while showing this safety and kindness. As you all know, there will be 16 stations. So one of them will be teaching approach. Now you are standing outside the cubicle. You have this question in front of you. There are 4 things that need to be considered. You have 90 seconds and you are reading your task. The first thing is who you are. You are FY2. In all the scenarios, you will be FY2. So either it is a counseling station, or it is Simon, or it is a combined station, you will be in FY2. Where you are, it is important. In teaching scenarios, mostly you will be in ward. However, in other scenarios, you might be in emergency department, or you will be in general practice. The approach would be different for different scenarios, but in teaching scenarios, you will be in ward mostly. If you will be not in the ward, we will be discussing those approaches separately. And who you are, to whom you are addressing. You are addressing to a student who is a 3rd year medical student. Okay, let me tell you one thing. Usually in UK system, the 3rd year medical students have a rotation of almost 1 week in multiple wards. So if you are an FY2 in inner unit, so 3rd year medical student will be a rotation of 1 week in inner unit. And I will be discussing with further approach that how to build a rapport while talking to the student. And now the most important thing, what is your task? Your task is to teach the procedure. That is the important thing. Teach the procedure, not give clinical knowledge, not give all the knowledge. For example, if you are teaching urine dipstick, you might give all the knowledge, like this is the bottle, and the color is it is straw colored. If it is dark colored, if it is red colored, then this, and if its odor is sweet, then this. No. They are not asking you to tell the abnormalities. They are not asking you to tell all the features of the urine. They're just asking you to teach it. So you are going to teach the procedure. You will get marks for it if you teach the procedure. If you are conveying all the knowledge to the student, then you will not get marks. So it is the most important line, which is the last line. In every other than this teaching, in every other scenario, you have to remain focused on the last line. What is your task? Because you have only 8 minutes and you have to complete your task in 8 minutes. Okay, so now you have spent your good 90 seconds outside the cubicle. Now you are entering into the room. Yeah, a student will be sitting in front of you, and there might be possible that examiner would be on the right side. So when you are going to enter into the room, you show that you are a doctor and you are a confident doctor. Make smile. Smile is the most important thing. When you will smile, it brings confidence in you, and it will give best impression when you will enter into the room. and make an eye contact. That is important. When you will make an eye contact and smile and be confident, that gives the first impression. And if it's good, then the student will connect. Your basic I will be telling you in first 4 steps, your basic approach would be to connect with the student so that you can get maximum marks in IPS, interpersonal skills. This improves your communication skills as well. So how to improve those communication skills, we will be discussing it step by step. And then the important thing comes. Okay, first introduce yourself. Okay, my name is Dr. Junaid, and sorry, don't say doctor in teaching scenarios. My name is Junaid. I am one of the F2s. If you are saying F2s, it is understood that you are a doctor. So my name is Junaid. I am one of the F2s. And important things, do not use doctor with your name. And if someone is FY1, which is junior doctor, do not use name, do not use prefix as a doctor with his or her name as well. So you just have to call first name. If it is John Adam, you have to call his John. You can say it like this: hello John, my name is Junaid and I am one of the F2s. How are you? This is the one approach that you can start your station. It looks natural and it will connect with the student as well. And always use first name of the student. Now the greet and introduce part has been done. Now we will go for repo. How to build a repo? It is important part. Now just imagine if you enter into the room, you greet a student and you start teaching urine dipstick. Like, hello John, my name is Junaid. I am one of the F2s. How are you? So this is the urine bottle. So we are going to I am going to teach you. No, this is not the right approach. You have to build repo. So I just in the beginning I told you that third year medical student. So it is possible that the student is on the rotation here in our ward, in the renal ward. So you can ask general questions. If he's on the rotation, you can ask about rotation. I have I wrote down the number of questions that you can ask, like how is your rotation going? How is everyone in the ward? Are you learning new things? Is there any difficulty? When are your exams approaching? When are your exams coming? And if,
बस इतना सही सोना है मैं भी लिया थोड़ा सा सही है इतना सही सोना है
sorry, can you please mute? Okay, so yes. Just give me a minute. Okay. So these are the questions that are necessary to build a repo. So it also shows the examiner that you have understood your task. You have read the task outside the room. That they.
sir.
Okay, so you have shown your examiner that you have understood your task and you have read the question outside the room very well. So now you have built a repo. The student will be happy that you have asked a number of questions about the rotation, about if he is having any problems during the rotation, if he is having difficulty, and if exams are approaching, you can just ask the student that if you need any help, I am here. You can ask me. I will help you. So that you can show your interest that I am always available for help. It also gives plus point while showing it to the examiner. Then comes the purpose. What is our purpose? I understand that we are here. You want to learn urine dipstick. I understand that we are here for a procedure. So now after grapes, build a repo and then purpose. So everything is coming in a sequence. So you have greeted student and then building a repo and then purpose. You are stating the purpose that we are here for some kind of procedure. Now, after the purpose, there comes the knowledge. Now, if you just imagine if you start teaching urine dipstick and the student already knows about the color clarity and the smell, he just want to learn about the procedure. You are just wasting your time. So you will ask the student, what do you already know about this procedure? Is there any specific step you want to learn, or you want to learn the whole procedure? That gives a plus point that you are checking the understanding of the student before you're going further. And that will also shows that you are well prepared and you are well prepared to teach the student what the procedure is coming. So there are 4 important steps before starting the procedure, and it would not take more than 1 or 1.5 minutes. So the first thing is you are standing outside, you have 90 seconds, just read the scenario, enter and greet, having a smile on the face and build a rapport, and then show the purpose and state the purpose, that why we are here, and check the knowledge, what has already been known by the student. Now comes the procedure part. So now in the procedure part, in the beginning, you have to, there are different procedures, like in the urine dipstick, you have to gather your equipment. In other scenarios, like examination scenarios, you have to take consent from the patient. You have to briefly explain what you are going to do. In the procedure, for example, it's abdominal procedure, you have to briefly explain we are going to perform an abdominal examination. So it would not hurt you. Should I continue? Should we continue? Because you're teaching a student, you are teaching student that consent is most important. In UK health system, consent is very important. So you mentioned that consent, you have to take consent before proceeding and check identity. I talked about one of our objectives is safety. So identity and consent comes in the safety part. You have to check the identity on urine dipstick. We will be discussing these scenarios one by one. So I will be telling you while teaching those scenarios as well. So on urine dipstick, on urine sample, it would be the name, NHS number, and date of birth of the patient. You have to tell the student that we check the identity first. So it shows that you are a safe doctor, you check the identity, you take the consent, and expiry date. Obviously, they are Epipen. You can check expiry date on the Epipen, and the container, your dipstick container, you have to check expiry date on the container. And you have to explain briefly about the position. And before starting the procedure, you have to wash hands and wear gloves. In almost all the scenarios, it will be written on the wall that assume you are gloved and washed hands. So there is no need to wash hands and wear gloves, because it will be assumed. However, in certain stations, like in urine dipstick, there will be an apron. I will show you the apron like this. There will be a roll. You have to just take one apron and then wear it like this. I will show you the videos as well, so that you have a better understanding how to wear an apron. An apron comes in the safety part as well, because your safety and the patient safety, these 2 things are must. So you have to show that you are a safe doctor. And so what comes in the safety? The washing hands, wearing gloves, wearing apron, and then taking consent, checking identity, checking expiry date. These things comes in a safety, and you have to explain why you are doing the procedure. And when you are doing the procedure, check understanding. I have seen a number of times the candidates just start doing the procedure and just look down. They don't look in the eyes of the student. Just look in the eyes of the student. Are you getting me? Am I clear? Is there anything you would like to repeat me? Is there any step which is unclear? Is there any ambiguity? If you have any problem, just let me know. I will repeat it for you. So you check the understanding, and you just have to check like 2 to 3 times. Don't ask too much. Just 1 or 2 times in the procedure. Just make an eye contact. When you will make an eye contact, you will know that whether the student is interested or not. This will also gives you a glimpse that if he's interested in teaching or not. Now, if the student doesn't show any interest, then you can involve student. And how to involve student? You can ask questions like, okay, John, what comes after this? Now, if you are teaching urine dipstick, okay, you are checking the color. So you can ask student that, okay, John, what we check after the color? Don't worry, we check clarity. So if he doesn't respond, no worries. Just support him and say the step on your own words. This will alert the student that you are involving, you are checking understanding, and you are well prepared to teach. So there are a few questions that you can ask, like if you don't understand, let me know, I will repeat. And if involve, what is normal value? You can ask what is not if what is normal glucose value in the urine, or in other scenarios by and by. And this again, discard everything. I have seen a number of candidates, they perform subcutaneous teaching. They do not discard shops in the shops bin. You will lose marks. You must remove shops in the shop bin and general waste in the waste bin. These things carry marks. This shows that you are safe doctor. Just imagine you performed a subcutaneous in real clinical setting, and you left the needle there on the table, and some other doctor comes and the needle pierces his hand, or damages the doctor. Then what would happen? You are not safe doctor, you are damaging you are risking others' life as well. So you must discard everything. If the bell rings, if 8 minutes are over, just discard quickly, but discard everything. If you are wearing the apron, if they are general waste like strips, paper towel, or anything, just discard everything. Well, in urine dipstick, do not discard urine, because the examiner would say don't discard it. But in real setting, you have to discard urine sample as well. And at the end, say thanks. So let me summarize all the main headings when how you are going to approach teaching station. So first, you will be standing outside. There will be 90 seconds. You will be having the scenario in front of you. Just memorize. Just make a map in your mind that what you are going to do now. For the first focus, the main focus should be on your task. So your task is to teach the procedure, and then you enter, you greet with a smile, the confidence, and then you build a rapport, and you state the purpose as well, and then you give the knowledge. You check the understanding, and you start the procedure. In the procedure, you check understanding and understanding of the student, and involve the student. And don't forget to complete the safety points, checks, or features, like checking identity, checking expiry dates, wearing apron, and then taking consents, yes, and then discard everything. That is the important thing. Discard shops in the shop bin and general waste in the waste bin. And at the end, say thank you. And in some stations, like in BLS, BLS comes in two ways. Sometimes you have to ask the student to repeat it. However, in other times, it is written outside that do not ask the student to repeat. If it's not written, then you can ask the student to repeat any step. So, and you have to mention, you have to point out the mistakes that has been done by the student. So there are the common mistakes. I have made a list. We are humans, we make mistakes, and mistakes makes us perfect. So we will try, when we are going to practice, we do not make these mistakes, because these are common mistakes. And these are the things that where we lose marks. So people do not smile, they're stressed. I understand that it's a stressful exam. Everyone understands that when you are standing outside the cubicle, it's very stressful. But you have to pretend, you have to react that that I am a doctor with a smile. Just don't be stressed. You have to just react it. They don't build rapport. They don't build rapport. Just start, enter, and then check understanding, and then start teaching. No, don't build. They don't build rapport. You have to build rapport by asking how is the rotation going, and about the ward, about the exams. It shows interest. And check identity and expiry date and mention consent. People don't do this because to be honest, in our settings, clinical settings, we do not do these things. We do not check identity. We do not check expiry dates, and we do not take consents. That's where we lose marks. So these things are important in UK health systems: the identity, expiry date, and consent. Don't miss these things. These are the important things. And some candidates do not check understanding. They enter into the cubicle. They greet with they're good. They're going good. They follow all the steps: greet, building rapport, purpose, knowledge. But they start teaching without checking understanding. Just they are doing dipstick and then verbalizing those steps. Do not do this. Do 1 or 2 steps, 3 steps, 4 steps. Ask the student, are you getting me? Am I clear? And then people do not discard sharps in the sharps bin and general waste in a waste bin. So you have to, all right. So you have to discard all general waste in the waste bin. That is necessary thing. Okay, so these are the common mistakes. I hope that now the approach is clear, that when you enter the room, greet, build rapport, purpose, knowledge, and then some safety points and checks, then checking understanding, then involving student, then discarding everything and saying thanks. If there is written outside that repeat, and ask the student to repeat, and point out mistakes, then ask the student to repeat and point out those mistakes. So this is the general approach that we are going to follow in all our 8 stations. There are 8 teaching stations which are coming frequently, and we have to follow this approach. Let's move on to our first procedure. This is urine dipstick. So we will be applying all what we have just learned. We will be applying this, and we will be checking this how we can complete this station in 8 minutes. Because time is most important. Some people say that they completed the station in 4 minutes, 5 minutes, or 6 minutes, and some people say that they were just in this beginning and the time over, and they couldn't perform the whole station. So we will be discussing that how we can complete this urine dipstick in 8 minutes. So this is the procedure urine dipstick. So you are standing outside the cubicle. The scenario is you are FY2 in a unit. A third-year medical student wants to learn how to perform urine dipstick. Again, those 4 things. You are FY2, you are in a unit. A third-year medical student wants to know how to perform. How to perform. Teach how to perform. Don't teach what are the normal colors, what does the sweet odor means, and what if urine is not clear, then what does that mean? Okay, so again, you enter into the room, grips with the student with a smile, greet, introduction, build rapport. How is your rotation going? If you have any problems, just let me know. When are your exams coming? Ask those questions, build a good rapport. Only 2 to 3 questions. Then purpose, and then understand that we are here for the urine dipstick, and you want to learn urine dipstick, so check the prior knowledge. What do you already know? Do you know what is urine dipstick? Do you know when we perform urine dipstick? What are the indications? So there are certain indications I have written here. If the patient doesn't, if the student doesn't know about the indications, you can say that there are a number of indications like a routine check for pregnancy, screen for diabetes, and urine infection, if there is blood in urine, and some people do it routinely. So it won't take more than 1 or 1.5 minutes. So this is your first part. You have done your first part very well. Now move on to the other part, which is gathering equipment. Equipments would be placed on a separate table. And let me tell you the real setting of the cubicle. There would be a student, there would be a desk in front of the student, and there would be a chair. You will be sitting on that chair. First, you will be doing all these 4 steps, and then there would be a table, either on the right side or left side, depending upon where your exam is in street or in square. There's the GMC buildings. Okay, so equipment will be placed there. First thing you will ask the student to let's perform this procedure. First thing is gather equipment. And what are those equipments? Apron, gloves, assumed you are gloves, that will be written on the wall that assumed you are gloved and you have washed hands. And these are stopwatch as well. Urine dipstick container, urine sample, and paper towel. These are the equipments. So the first step is the steps of procedure. I will be showing you the video as well when we will done with this scenario. Then you can watch the video that will help you in how this urine dipstick is performed. So first thing is wear apron. That is the most important things. I have seen people that who do not wear apron, they fail the exam. You know, show there might be other reasons as well, but apron shows that you are following the protocol, the universal safety protocol. So the apron would be like this. The roll, it would be in roll form. It would be placed on the table. You have to take one apron from there and just wear it like this. In the video, it will be shown that how to wear the apron. So it is the important thing. The first thing is wear apron and just give to the student as well. Just ask him, you want this apron? He would certainly say no. So just show that you also need an apron because we are going to examine urine. Okay, then again, safety check identity. Now you have assumed yet that you have gloved and you have wear the apron, you are good to go. Now pick up the urine sample and show it to the student. We will check the identity first. The name of the student, the name of the patient, date of birth, and an NHS number. We check 3 things on identity. And when you will be performing this in real exam, in PLAB 2 exam, on the sample bottle, it would be written. These 3 things would be written. So you do not have to miss this step. Wear apron and then patient details. Now comes the important part, how to save time. Inspect color. Now you have the urine in your hands and you're going to inspect color. One way is that you can involve student. But I suggest that you can ask that, okay, John, what is the normal color of the urine? You can just involve the student that everyone knows it's straw colored. John is a 3rd year medical student. He should know that it's a straw colored. So you can involve student that, John, what is the normal color of the urine? Okay, if he replies, it's good. If he doesn't, okay, John, don't worry, it's straw colored. And do you think it's straw colored? Yes, it is straw colored. Just 2 lines and you are good with color. Then go for the clarity. And I think it's a clear. Then we check the John, after checking color, we check the clarity, and it is a clear urine. What do you think? Okay, and then open the lid of the urine sample and just smell it. And I think it's odorless. Okay, so we have gone through 3 things: color, clarity, and odor in just like 10 to 20 seconds. Or maximum 30 seconds. So we did not give any information about abnormalities, but we covered what is shown to us, what is important for the student to teach. We have taught the student about color, clarity, and the smell. So these 3 things have been covered in just 30 or 40 seconds. Okay, John. So now we are going to perform it. Let's see how we're going to perform. Okay, I have written all the abnormalities here because sometimes it is possible that John might ask you a question. So, doctor, what does red urine mean? You can explain it's because of the presence of blood, hematuria, and there are a number of causes. There are certain drugs and there are certain conditions like CA, prostate, or there are some renal problems as well. In those problems, there is a blood in the urine. So if he asks question, then you have to discuss other colors as well. So it's a good question that you have asked that red color. What does the red color indicates? Do you know? Other than red, there is a dark color urine as well, which shows dehydration, and brown color as well. Remember, if he asks, if he shows interest, if he doesn't show interest, just mention color, clarity, and odor. It is just for you people to just go through it so that you can have an idea that if you ask question, how to tackle that question. Usually they do not ask any question. They ask questions in parameters. I will be showing you, I will be telling you how they ask questions in parameters. Like there are different, there are 10 parameters and they will be asking questions there. So this is the container. This is the container and it has 10 parameters. So now you go to the procedure, you pick up the container bottle, and you verbalize to the John that to the student that in the container, first we check expiry date. There is the expiry date. It will be visible in the video. I will show you the video at the end of this scenario. So you can just show that you have checked the expiry date. It would give a positive point to the examiner, and that examiner would pick up this point that he knows how to show, he or she knows that the expiry is important. So tell the John that we see the expiry date, then there are 10 parameters like glucose, bilirubin, ketones, and pH, and other. You can verbalize 2 to 3 and then just go on. And there are seconds. The seconds are important. 30 seconds, 30 seconds, 40 seconds. These are written just below the parameters. And why these are important, we will be discussing in a while. Now, start, make an eye contact, check understanding involved while doing the procedure, check expiry date first, and briefly explain there are 10 parameters. And now open the container and remove one strip from the container. And just quickly close the lid because it can oxidize other strips and can damage the other strips. You can mention this to the student as well. Okay, John, we will just take one of the strips out quickly and then we will close the lid quickly. Because there are chances that other strips could be oxidized. It can damage them. So that's why we close the lid quickly. So now you have the urine sample. You have the strip in your one hand. Don't touch the parameters. Don't touch the different colors. There's the one end of the strip where there are no parameters. You have to hold the strip from that end and place a paper towel and a watch in front of you. Just dip the strip into the urine sample for 2 to 5 seconds, completely immersed into it, and placed on the paper towel horizontally, and immediately start stopwatch. Now you have 30 seconds. In those 30 seconds, you can interact with the student. Okay, John, so have you understood all the steps? Do you have any questions until now? If you are unclear about anything, just tell me. If you have any questions, you can ask me. There is a possibility that he might ask you, doctor, what does glucose mean? Well, if there is a glucose if glucose comes in the urine, what does that mean? They ask usually one question or two questions, or they do not ask any question. So now 30 seconds have been passed. You take the strip, compare it with the container like this. Now, if he asks the question, what is the glucose? So John, we compare glucose at 30 seconds. Tell me, how much glucose in this urine? You compare in front of by showing to the student that I am going to compare it. I am comparing it. Just tell me. So if there is nil glucose, yes, there is no glucose in the urine. Then you move forward. We will check other parameters like bilirubin, ketones, nitrates, and all these things. And there's a possibility that the other questions. I have made questions. Okay, there are certain questions. Okay, these are the questions. He might ask you if urine is cloudy. That indicates protein. What if there are proteins? There are certain conditions in which the urine has proteins such as glomerulonephritis, nephrotic syndrome, diabetic nephropathy. What does blood in it mean? Stones, UTI, bladder CA, glomerulonephritis, all smelling urobilinogen, nitrates, bilirubin. So you must be ready. If he asks any question, answer those questions at that step. Just stop there, answer those questions, because it is important, because he has asked you a question, you have to answer. Okay, so now you have performed it. While performing this, okay, I have unmuted it. Okay, it is when you are going to perform it, almost it would take 4 to 5 minutes, or you will have almost 1 minute left, or maximum 1.5 minutes. In that minute, you have to discard everything. Discard first a strip and paper towel. Do not discard urine sample. Now pick up the urine sample, and now if you have 2 minutes, if you have 1 minute, now you can tell student, like, okay, John, let's discuss if the color of the urine is dark. It shows that it is dehydrated. Okay, if the color is brown, it shows the presence of bile pigments. If it's cloudy, it indicates infection. Now is the time that you can tell the John or tell the student about abnormalities. Understood? Look, your main task was to teach the student how to perform urine dipstick. You have explained each and everything to the student. You have the student doesn't have any questions now. Now you have, if you have time, you can explain. And if the bell rings, do not forget to discard apron as well. I have seen people, they go to the next station with apron wearing. So do not do this, just discard apron as well, because it also comes in general waste. So waste, there will be a waste bin that will be placed on the right side of the table. Do not forget to discard your apron. So let's discuss some common mistakes. People don't build rapport. This is the common mistake in all the teaching scenarios. They don't wear apron. I have seen people that they just pretend that I am wearing apron. Just pretend with the hands I am wearing apron. No, you have to wear apron. These are apron. It's in the roll form like this. It's in the roll form like this, and you have to wear it. So wear the apron and ask the student to wear apron as well. People do not make eye contact. They just move down and just doing the procedure and do not make any eye contact. They do not respond questions. They do not check understanding and involvement of the student. That's important. You know, teaching is just like a discussion. You have to ask questions, involve students, and doing all these things to show that you are interested in teaching. People explain too much. They start explaining in the beginning that the color, different colors, brown color, dark color, red color. They start explaining about cloudiness. They start explaining about sweet odor. They start explaining about everything. No, your task is to teach. Your task is not to teach abnormalities. What does the black color mean? What does the dark color mean? It is not your task. Everyone knows that they are doctors. They know what does the dark color mean. Okay, they do not check expiry. This is one of the safety features. You have to check expiry and do not discard things appropriately. These three things are important. These comes in safety: apron, expiry, discard. So you do not forget to apply these things in your real life clinical scenario in your exams and in your real life as well. When you will be doing this in your real life, you will develop a reflex to do this in the exam as well. There are the parameters. There are 10 parameters. I have made a table. You can see that glucose shows up 30 seconds, and absence of glucose and the presence of glucose, and similarly bilirubin, ketones, specific gravity. You can see I have presented in a tabulated form so that it would be easier for you to read and go through all of them. There's no need to explain all of them. If we ask questions, sometimes they ask question proteins. What is the cause of protein nephrotic syndrome or chronic kidney disease? You can just go through it, and if you ask questions, you can answer those questions. And remember, there are seconds written. If you are 30 seconds have been passed, if you are checking glucose, if he asks you about nitrates, you can ask me, okay, John, wait for 60 seconds. Nitrates comes at 60 seconds. After 60 on the stopwatch, see after 60 seconds. So let's check nitrates. Show interest, show reality. Don't pretend that you're just checking nitrates. After 60 seconds, check nitrates. So that's all about urine dipstick. First, enter into the room, create introduction, build rapport, purpose, knowledge, and then go to the table, gather equipment, assume you are gloved, wear apron, start teaching, checking understanding, involvement, and then discarding everything, answering questions, and then discarding your apron as well. So now I am posting this link. Just give me a minute. Okay. Okay, I am posting this link in the comment section. Just watch this. In the chat box. Okay. Just watch this video and see how the candidate who is performing with dipstick, how he follows safety features. Just watch this video and just let me know when you are done with watching. That's great. So now you might have an idea that how the candidate follows the safety protocols, how he wears the apron, and how he checks the identity, and how he discards everything properly. So in real exam, you have to do and follow all these steps, because the examiner has this the paper, they are the boxes on it, and they tick boxes when you follow these steps. So don't forget to follow the safety features. Yes, they have in the real exam there will be a stopwatch. When you put the strip on the paper towel, you have to start the stopwatch. At that time, you start a stopwatch, and after 30 seconds, you can start checking glucose and other parameters. I hope this clears. Okay, so let's move towards our second scenario. It's adult BLS teaching. Okay. Okay, that's a good question. In the video, it's performing analysis, but here it is teaching. We are doing teaching. I just showed you the video to just follow the safety protocols. While we are teaching, we have to verbalize each and every step. In the video, it's just performing. It's another scenario. It comes in practical scenarios. If it comes in practical scenario, then you do not have to verbalize steps. However, if it comes in teaching, then you have to verbalize each and every step, because there's a difference between teaching and doing independently. All right. So let's move towards our second scenario. It's adult BLS. It's also coming frequently. So again, you are standing outside the cubicle. You have 90 seconds. You are working as a foundation year 2 doctor, who you are, FY2, in emergency department. That's fine, you are emergency department. And where you are, emergency department, you have a 5th year medical student to whom you are going to address. 5th year medical student. They usually come like for a month in for the rotations, so it doesn't matter. And what's the name? It's Rio. So always call him with first name. And he has no idea about basic life support, and teach him. What is your task? Teach him the basic life support. Okay. So I have shared a picture. This is the proper way to do the CPR. We will be discussing it later on. Again, you enter into the room, have a smile on face, and be confident. Just start with the confidence, and start with your introduction. Hello, Rio. My name is Junaid. I am one of the F2s. How are you? So it's your perfect introduction. Then build a rapport. Again, how's your rotation going? He's a final year medical student. He's there in the emergency department for rotation. How's your rotation going? Are you learning new things? I understand that emergency department they are the hectic duties. So is there any problem? Do you want help in any matters? Ask 1 or 2 questions, not too many questions. You will be wasting your time. And then purpose. I understand that you want to learn BLS. You missed your BLS workshop. Don't worry, I am here to teach you. And then check knowledge. So Rio, what is your understanding about BLS? What is your understanding about basic life support? What do you already know? Do you know when we perform this BLS? You can ask 1 question among 3 questions that I have just said. So how much he would probably say, doctor, I do not know anything. In most of the teaching scenarios, the student would say that, doctor, I do not know anything. I want to learn whole procedure. in some scenarios, like in testicular and groin, it is possible that the student would say, doctor, I just want to learn testicular, doctor, I just want to learn groin and testicular both, or I just want to learn groin. Other than that, in all the other scenarios, they would be saying that, doctor, I do not know anything about it, teach me everything. So it's just to check the understanding of the student. So you will state that there are certain indications like cardiac arrest, respiratory arrest, and when we perform the basic life support, you are in emergency, we will have a chance, we will show you practically when we will be performing BLS. For now, there will be a dummy, and you will be performing on that dummy. The mannequin will look like this. Just familiarize yourself with this mannequin. You will be having similar mannequin in the exam. So familiarizing thing will make you more confident. You will be confident that when you are standing outside the cubicle, you are reading the scenario, you will be known, you will know that what's inside. It would be a mannequin inside it, and I have performed BLS. That leaves worries most of the times. Okay, so now again, after indications asked students, so okay, Rio, I'm going to perform. So if you have, you perform BLS on the patients who have cardiac arrest and respiratory arrest, you cannot take consent, you cannot talk to them. So just you have to perform it. Just go and perform. So, okay, Rio, I'm going to perform it. If you have any questions in between, just ask me. I will repeat those steps for you. Because this is a mannequin, so you can ask me to repeat. You can start it like this, and then there's a mnemonic. This is DRS AB 999C. D for danger, check for danger. You all know, first we check the danger. Just repeat it in front of the student that how we check the danger. We remove all the electrical wires or water. If we see anything, we remove everything from the mannequin, from the dummy. And then response. Check the victim for a response, like, are you all right, mister? Just say it loudly. So that you check the response. It is possible that someone is resting under the tree and you are going to start CPR. It's not like this. You just check the response first. Well, you are teaching in the exam. Don't say these words. You just say go with proper steps and following an approach. You just don't talk about other things other than teaching. In the exam, you have to be serious and look professional. So check the response. Are you all right? And then shout. Shout for help. Help, help, help. In 3 directions. Like help, help, help. Loudly and in 3 directions. While teaching, you have to say it loudly to show the student that we say it loudly. Help, help, help. So DRS and then airways. We check the airways, and it's a simple head tilt and chin lift method. This one thing that candidates usually make a mistake, that they do head tilt, but when they are lifting their chin, they don't do this from the bony prominence. They just there's a latex skin over the dummy, over the mannequin. They just do it from there. Don't do this. Just hold the bony prominence of the chin and then do this head tilt and chin lift, and then check the airways to show the student that you are doing it right. And then breathing, look, listen, and feel what you are looking. The movement of chest, upward and downward movement of the chest, and then listen to the like the breathing sounds, and feel the hot air, warm air on your cheeks, like this. In COVID, we do not perform this breathing, but now people are starting performing this breathing part as well. So now there's a time to call 999 or 2222. If you are outside, mention this to the student, that if you are outside the hospital, you have to call 999 for the ambulance. And if you are inside the hospital, like in the emergency, in any ward, in the emergency department, there are doctors, they just start doing this. But in the ward, you have to call double for the help, because it might be possible that you have to perform ACLS or ALS, advanced life support as well, along with BLS. So that's why we ask for help. So it's clear: first danger, response, and then shout, then check airways and breathing and dial. So Rio, am I clear so far? All right, so let's move to the circulation, the main and important part. This in the circulation, we perform compressions. And how do we perform compressions? Just verbalize it and ask and tell the student that how we are going to place our hands, like place our dominant hand just to one hand in the center of the victim's chest, and then just place on the chest and your dominant hand, and the other hand on it, and make a firm lock with your hands, and then lock your elbows. Lock your elbows. I have just highlighted it, and just lock your elbows, and then start doing compressions. And you should go 5 to 6 centimeter, 5 to 6 centimeter below, and then the rate should be 100 or 120 minutes per just compressions per minute. So it should be like this. You can count. You can count 1, 2, 3, 4, 5. Just doing compressions and teaching the student that I am going these compressions. Okay, and then give rescue breaths. In COVID, we do not give rescue breaths by mouth to mouth. We give rescue breaths by using ambu bag. So after every 30 compressions, you have to give 2 rescue breaths. Okay, so it's simple: DRS, AB, 999C. Danger, response, shout, airways, breathing, call 999, 22, check circulation. Circulation means start doing compressions. So there might be questions like, for how long we are going to perform this BLS? Until you are tired, or until the victim comes in his senses or becomes conscious. So you have to perform BLS until the victim comes into consciousness, or you are tired, or help arrives. Because your safety is also important. So you just verbalize these things if the student asks questions. So in some scenarios, it would be written outside the cubicle that ask the student to perform it and point out mistakes. So now it would take almost 4 to 5 minutes. Now it should be in your mind that you have to ask the student to perform. You have to do it quickly. If it's not written outside, if it's written that do not ask the student to perform, then keep things keep doing things slowly, or explaining more, or repeating steps, or summarizing all those steps, so that you can have 8 minutes inside the cubicle, a good 8 minutes. And then if it's written that the student performs, then student might do mistakes like this. I have written these. Usually they perform 2 mistakes. They do 5 compressions and then stop, and then start doing the start blowing air. So you just stop the student there, ask him to do 30 compressions. Do you do 30 compressions? After that we will do this breathing part. Okay, they do not call 999. They just go DRS, ABC. They do not follow the 999. Obviously not calling ambulance, 999 for ambulance, and not making hands straight, elbows straight. They do not put their effort from their body. No, you have to put weight from your body, not from your hands or arms. So when you put your body's weight, it looks natural. It is you do not tire easily. Okay, all right. So this is the simple approach. The student might make mistakes. You have to point out those mistakes and do this BLS. I understand that without mannequin, without these obviously these dummies, it is difficult to perform these procedures. What you can do, you can use pillow in your house, or if you're anywhere, you can use pillow and you can do these steps. Just make a reflex so that if it comes into in your real exam, your reflex should be straight. So you have to follow these steps. And then there are common mistakes. People do not check airway by head tilt and chin lift. They do not hold bony prominence. And other than that, the mistakes that the student candidates also does, they forgot to call 999, and they do not shout loudly. They just say help, help, help. Don't say loudly, help, help, help. Just say it. Don't worry about anything, because you just think that you are in your real life scenario. Just say it loudly. And then if the student asks, and at the end of the station, you can ask student to summarize, or you can summarize to a student that danger, response, shout, airways, breathing, 999, and circulation. And then you can close your conversation like this. If you want further reading, you can go to Resuscitation Council UK. You can read further about this BLS. Now here comes the third, the important one, subcutaneous injection. It's coming more frequently nowadays, and it is important as well. One of the safety features I will tell you in the scenario, at the end of this scenario, that is most important. People do not follow it, and most of the time they lose marks for that. So again, you are FY2 in ER, a third year medical student. Remember, third year. I want to learn subcutaneous injection. Lori, third year medical student, all right. Teach him how to administer. Your task is how to administer subcutaneous injection. Don't ask him to perform. All right, so let me familiarize you with the mannequin, with this pad. This is subcutaneous pad. You will have the similar pad in your exam. Can you see this? This is just made of plastic, and you have similar this in your exam. Again, you have good 90 seconds outside your cubicle. You have make a map in your mind that how you're going to enter into the room and how you're going to approach. Now you're going to enter into the room. Again, grips with the student, greet, introduction, smile, confident. Hello, Lori. My name is Junaid. I am one of the F2s. How are you? Build rapport. How's your rotation going? How's everything? Is there anything I can help you with that? If you need any help, just let me know. I understand that you are here to learn subcutaneous injection. I am here to teach you. Just stay with me. And what do you already know about this subcutaneous injection, Lori? Okay. All right. So do you know what are the indications? So these are the certain indications I have written here. These are the insulin, opioids. You give morphine by subcutaneous injections, and heparin, epinephrine, and allergic medications. There are some rare complications you can mention while teaching. The subcutaneous injection comes in two ways, one in teaching and one in practical. So you have to verbalize, you have to say these indication complications in both these scenarios, in teaching as well, while performing practical as well. So there might be some complications. If it's in practical, then you have to tell these complications to the patient. If it's in teaching, to the student, that hematoma can be formed. There is possibility that the persistent nodules and local irritation and so on and so forth. Don't waste too much time initially, because you have a lot to teach. So teaching. First, again, go to the table, gather equipment. You will have pre-filled syringes with heparin, no needles. You will have pre-filled syringe with the heparin. There will be alcohol swab or cotton wool or gauze. Injection pad like this, and clinical waste bin and sharps bin. Sharps bin are yellow in color. I will be showing you the video after this. You can have a better understanding that what sharps bin looks like and how to discard things into sharps bin. and a tray, kidney tray usually, and a drug chart, the important thing, drug chart. We will be discussing about this later on. Now you have gathered your equipments in a kidney tray. There will be no apron. They will be written on a page in front of you on the wall that assume you are gloved, assume you are wearing apron, assume you are following universal safety protocols. Okay, so you have gathered your equipment. The student is with you, Lori, and go to the patient. Now, just verbalize it, because now you are teaching it, but you have to consider that if it's in real life settings. So how you are going to teach Lori that you should remain safe, doctor? How? So you will verbalize like this. Okay, Lori, we have gathered our equipments. Now we will go to the patient. We will greet with the patient, introduce ourselves, and briefly explain what we are going to do, and then take consent from the patient. These things are important, that you are showing the examiner that you know what is meant by consent, what is meant by telling something before doing any procedure, what is the value of consent in the hospital settings. So you will get extra marks for this. Then you will have a pad in front of you like this. Then you will ask the student, okay, if you have any questions in between the procedure, just let me know. There comes the important thing, final checks. 3 things and 3 questions. Don't forget, at any cost, these are the safety checks. Drug with the expiry. They are pre-filled heparin syringes. The expiry date will be placed on the syringe. Just verbalize in front of the Lori that, Lori, no, this is pre-filled heparin syringe. We check first the expiry date, and we check the dose from the drug chart. Important. I have mentioned in the beginning that in equipment there would be a drug chart. So this is important. Check dose on a drug chart and check identity of the patient from the wristband. And there are questions, there are 3 questions. These 3 things are important: drug with expiry, drug chart, and patient. Check the wristband. And now 3 questions. 3 questions to be asked from the patient. Do you have any arm preferences? Like some people like to be injected on the left side because they are right-handed and they do not want their right hand to be disturbed. So check arm preference. Ask for breathing problems. Allergies. Do you have any allergies? Allergies are very important in health settings. If you are in this UK, if you are doing any other scenario, like other than teaching, there are 15 more scenarios. Allergies are very important. You have to ask about allergies at every cost, because it's more common in UK system. And do you have any needle phobias? You have to ask these 3 questions. 3 things: drug with expiry, drug chart, and patient with the wristband, patient identity, and 3 questions: any arm preference, breathing problems, and needle phobias. Inspect injection site, and while you will be pointing out towards this pad, you have to verbalize these things. Okay, Lori, avoid areas of inflammation, rotate the area of injection, and do not inject on the same site. Procedure. Now, again, assume you are gloved, everything is there. You have the apron. Please mute your mics. Okay. So now you're going to inject. You're going to teach. Just remember one thing you're going to teach. Just make an eye contact as well. Eye contact is important. You can make like 2 to 3 eye contacts during your procedure. Not too much, not like that you are not making any eye contact. And lift the skin from your thumb and index finger. And there comes the important thing. That is also included in safety. So, Lori, when you are going to inject this subcutaneous injection, ask the patient that a sharp scratch is coming. So if the patient is John, a sharp scratch is coming. Just say it like this: a sharp scratch is coming. It is a warning to the patient that I'm going to inject. Then at 90 or 45 degrees, just inject into the skin fold. Inject slowly, and you have to follow this. Just verbalize these steps to the student so that he might understand well. And then an important part: sharp spin. Remove the whole needle into the sharp spin. Okay, sharp spin are yellow in color, and it carries maximum marks. Again, I told you in the beginning that if you left needles on the table, if someone comes, the other doctor come and he's pierced with the needle, then who is going to responsible for that? You are going to responsible for that. You are not a safe doctor. So sharps in the sharp bin. Just remember it. A number of people, like most of the people, do this mistake. They do not discard sharps in the sharp bin. They just place it on the table and then they go to the next station. Okay, mark the injection site. You can just tell or verbalize. If there's a marker, then you can do this. But in real exam, there is no marker. Just verbalize it. And we are going to mark this site and document details. That is also important. Okay, Lori, you have document that what dose at what time you have given to the patient, and all these things into the papers, and thank the patient. So again, discard sharps and sharp bin. That is the important thing. Waste in the waste bin. If there are any other wastes, and I hope yes, the cotton wool, the gauze piece, just those wastes in the waste bin. Don't put these cotton wool and gauze pieces into the sharp bin. They are separate. There will be a separate dustbin for the waste. Okay, there are certain sites of supplement injection. If you have time, you can verbalize these sites. If you think, just practice on your own. You just familiarize it. How much time are you taking? If you are taking like 4 to 5 minutes, then you can state these sites of supplement injection in the beginning. Okay, Lloyd, do you know what sites on what sites do we give this supplement injection? You can state this in the beginning. But if you practice and you are taking like 7 minutes or 8 minutes, then do not verbalize this in the beginning. You can place it at the end. Lloyd, let's discuss about the sites. There are 5 or 6 important sites. They are the upper abdomen, outside of the outer aspect of the arm, thighs, buttocks, and so on and so forth. You can state all these sites, and there are questions. So Lori can ask questions. Yes, of course. She can ask, what is the angle of the needle? What should be the angle? Doctor, what should be the angle of the needle? And what are the other sites? And why we give supplement injections? You might ask in the beginning. Common mistakes: don't take consent. Don't mention about the consent, taking consent from the patient to the student. Mention it to the student that consent is important. And don't check identity, patient drug chart, and don't discard needles in the sharp spin. These things carry marks. You have to discard everything in the sharp spin. Okay, so again, I'm going to summarize it. You enter into the room, you see the student sitting in front of you, greet, introduction, build rapport, state purpose, check knowledge, tell the indications, contraindications, go to the table, assume you are gloved, gather your equipments, and take consent, important thing, from the patient, and then a sharp scratch is coming, discard everything, sharps into the sharps bin, and at the end say thank you, and that's it. I'm going to post another video. You have to watch it. It's subcutaneous. Okay. Just watch this video. Just familiarize with the sharps bin. It's yellow in color, and just familiarize with the technique, how they are going to do this. But remember, it is just they are performing, they are not teaching. So it's slightly different. And how they take consent, that is also important. That's great. So now I hope you have been familiarized with how to take consent and how the sharp spin looks like and how to discard things and the sharp scratch is coming. Just familiarize all these things and do not forget to do these steps in the real exam. Right. So let's move towards our fourth scenario. It's speculum examination. This examination comes in teaching as well, in the practical examination as well. It comes in both ways. So again, you are standing outside the cubicle. You have the scenario, you are FY2 in Obs and Gynae, a third-year medical student, has never seen speculum exam being done before, and you have been asked to conduct a workshop, teach how to perform speculum exam. Again, 4 things: you are FY2, Obs and Gynae, third-year medical student. And what is your task? Perform speculum, teach how to perform speculum examination. First, let me show you the speculum, how it looks like. This is the speculum. These are the blades, and this is the knob that we use, tighten it, and it's very delicate. Usually, it's the plastic from the nature, and it breaks easily. I will be telling you that how to use it, by, like hold it. And this is the brush. It comes like this, and when you're going to put it in tray, just remove the covering. We'll be discussing it about this later on. So again, you enter into the room, greet, introduce. So it's third year. Okay, all right. My name is Junaid. I am one of the F2s. How are you? And build rapport and state the purpose of the meeting. Why we are here. I understand that you want to learn speculum examination. So I am here to teach you. Don't worry. Check knowledge. The purpose of examination, what do you already know about the speculum examination? I understand that you are a third-year medical student. he would probably say that I do not know much about this. Okay, it's just 5 minutes break, just it's a prayer time, just a 5-minute break. Okay, let's start speculum examination. Okay, am I visible to? Okay, my screen is visible to everyone, and am I clear? My voice. To. Okay, okay, that's great. Okay, so again, you're FY2 in Obs and Gynae, third year medical student, and he's here for to learn how to do a speculum examination. You enter into the room, smile, greet, introduce. Now, building rapport, again, same building rapport. So how is this third year medical student? So they are there for 1 week. Just ask about rotation, about the exams. Are there any exams coming? And is everyone helpful in this ward? Are you facing any kind of problems? And then purpose of the meeting. I understand that you are here to learn speculum examination. Don't worry, I will teach you each and everything, and then check knowledge. So what do you already know about speculum examination? And do you know when we perform this? So the purpose is to look and size the shape of the external and internal reproductive organs. And we do pap smear, which we check for bleed, discharge, and during labor. There are no absolute contraindications. However, there are contraindications for pap smear. You need to understand that these two things are different. In the pap smear, you have to take samples. You have to take samples from this brush. So there are certain contraindications, but for the speculum examination, they are not. Okay, so just a quick introduction, and then you're on the table. Again, in this scenario, again, the patient is involved. So again, you have to introduce yourself, just verbalize it to the student that you have to introduce yourself to the patient. Explain purpose of examination briefly, that we are going to perform this speculum examination. This speculum looks like this. We are going to take some samples as well. And just after explaining briefly, take consent. Should we proceed? Can we proceed? And a chaperone. Chaperone, this term is obviously new for us. It could be anyone. It could be anyone from the ward. Like if she's female, then any nurse or anyone from the ward. You just mention it. A chaperone would be provided. A chaperone would be there. Offer chaperone. Just do this. Just because you are teaching, so you just offer. Take consent and offer a chaperone. And this is the important thing, empty the bladder. This thing, empty the bladder, when you are going to do the practical examination or you're going to teach, both of the times candidates miss out this empty the bladder thing, because they think that it's not important. It is important. You just ask the patient, do you need to pee? Do you need to go to the toilet? Just ask like this. It covers all this, like if she needs to empty the bladder. Do you think that you need to empty the bladder? Just make your own sentences. It's fine. And then position. Position is also important. It's like that, bending your knees, bringing your heels to the bottom, and your legs wide apart. It's modified lithotomy position. So just verbalize these four things: introduction, consent, chaperone, empty bladder, and position to the student. And then they would be a dummy. They would be mannequin. You have to perform speculum examination on the mannequin. Again, gather your equipment. Assume you are gloved. It would be written there in front of the wall that assume you are gloved and you have washed hands and apron has been worn. So there will be no apron, no gloves. Okay, there will be a flexible light source. In real exam, yes, there would be a flexible light source. It would be, usually it is adjusted. So there's no need to adjust. However, if you think that you need to show the examiner that there is a light, then you can just pretend that I'm just adjusting light. Otherwise, there is no need to adjust light. And then lubricating jelly, it comes in the sachet. there on the table, there will be a sachet there, and then it's like a sachet, and you have to just open it and place it on, just cover this speculum with the jelly. And then speculum looks like this. This is speculum, and then brush. This is cervical brush. Now, this thing is prepare and gather. What does that mean? Prepare means you have to just bring it out, this brush from the covering. Just unwrap it into the kidney tray in the sterile technique. Do not touch the brush. Just open it like this, and just place it in the kidney tray. Do not touch the brush. And there are two containers: thin prep and sure path. The container looks like this, and this is thin prep, and sure path is the same like this. So we will be discussing that why these containers are there and what to do with those containers. Okay, then now you have gathered your equipment and you have everything. Now you have taken the consent. There is a chaperone. Position have been explained. Just go to the patient to undress, and the chaperone will be there. And now you start explaining the procedure, that what we are going to do to the student. We see external examination. We check for any lesions, any ulcers, discharge, or signs of disease. Internal examination, we check the cervix. Cervix is an important thing because we have to take samples from there. So location of the cervix, the speculum, and we have to take swabs or smears. Just mention these things because later on we have to take samples, and I will tell you how to take the samples as well. So now just after examining the external genitalia, you have to now insert the speculum. Hold speculum in your right hand in such a way that you need a speculum. You try to just familiarize with the speculum before going to the exam, so that you may not feel difficulty when you are going this examination, real exam. So there is a proper technique to handle it. Like you have to make hand like this. So hand it carefully and explain the patient. Now again, like the previous one, before injecting, we explain the patient that a sharp scratch is coming. In this, again, we explain the patient that we are going to insert speculum in your private part or in your genitalia. Now there's a technique: spread the labia and then go like I will show the video that how to go inwards, and then first straight and then downwards, and then rotate it. And when you open it, cervix should be there. In 90% of the cases, especially in street exams, street is exam center in exam center of GMC, the examiner would be standing right behind you. So you need to, don't worry, don't stress out. If the examiner is just behind you, don't stress out. He is just here to see whether you're performing right or not. Just go straight and go downwards and rotate it. And when you open it, the cervix should be there in front of it. So the examiner would see if the cervix is there, then he will go back or he will be staying there. But when you will see the video, you will have a better understanding that how to go inwards and then how to show the cervix. And same, then tighten the knob, place cervix speculum there. And now the time to take samples. This is the brush. You have uncovered the brush into the kidney tray. Now time to take samples. How to take sample? The soft brush is there. You have to just rotate it on the cervix 5 times, 360 degree, like the whole circle. 5 times you have to rotate it. And now you have two containers. In the thin prep, you have to dip your brush 10 times. Just dip it like 10 times. And then in the sure path, you have to the one end of this brush, this end is detachable. So it can be detached, and you can place this detachable portion, the white portion, into the sure path. Usually in real exam, there would be only one container. Either it would be a sure path or thin prep. Just remember, if it is thin prep, you have to dip 10 times. If it is short path, you have to detach this white part into the short path. Remember these two things. It could be any one of them, but there will be only one. Just remember this. Do not forget this. There, you have, if there is thin prep, you just drop this head of this brush, then you will lose marks. In thin prep, you have to dip 10 times. In short path, you have to detach the head, the white portion, into the container. Container is usually open from the upper end. And then label. The labeling part is important. It just reminds me the question. There is a scenario in PLAB 2 that the patient lost blood samples, and the doctor lost blood samples, and he forgot to label those blood samples. So now the doctor has to make excuses or say sorry to the patient. There's a scenario in this PLAB 2 exam. You better know that. So that's why labeling is important. So that after taking the sample, you don't have to say sorry to the patient that we have to take this sample again, or we have lost your sample. So labeling is important. So yeah, in real settings, there would be no marker there, but you have to mention it to the student that we would label our sample, these samples that we have taken, and the results will be given to the patient in 2 weeks' time. Now, this is general information. All women who are registered with GP invited for cervical screening from age 25 to 49 years, every 3 years, and age 50 to 64, every 5 years, and after 65 only when they are normal tests. Again, just familiarize with it. You enter into the room, you may greet, introduce, build rapport, and then purpose. What is the purpose? The knowledge, what you already know. Go to the table, take consent from the patient, explain, and then take consent, and then gather your equipment. Just place it in the kidney tray, speculum, brush, everything, the lubricating gel. And before inserting the speculum, apply lubricating gel, and then insert, and then show cervix, take samples in 2 containers, thin prep, short path. Remember, thin prep is for dipping, and short path is for head, the white part. So if it would be mentioned on the container when you go inside, we mention it, either it is thin prep or short path. If it is short path, just drop down that head. If it is thin prep, just dip 10 times. It's that simple. Don't worry. Okay, so now I am there. Okay, there are questions. Now, what are the main steps and when to perform, how to perform, and can you please repeat this sampling technique? Can you please repeat this step, this step? There might be 1 or 2 questions, or there might be no questions. It depends upon the day. Okay. The common mistakes: don't explain, take consent from the patient, no proper technique, or don't label at the end. Now, again, watch video so you have better understanding. Here, watch video and just see that how they take consent and how cervix is visible. That is the important part. Cervix should be visible, because most of the times examiners are there and they see either cervix is visible or not, and how they insert it, how they rotate it at 90 degree, and then how they tighten the knob. These 3 to 4 things should be you should be focusing on. Sorry, it was muted. Okay. Now clear? Can you hear me? Is my voice clear? Yes. Okay. That's great. Okay. Again, our fifth scenario is testicular teaching. Again, 4 things. You are what? You are FY2. Where? In urology ward. Who is in front of you? A student. And what is your task? How to perform testicular and groin examination. And remember, it would be written like this. Do not ask him to perform the examination. Then there is no need to ask him even to repeat the step on the mannequin. Do not ask this. Just go through it, just teach it, and just that's it. That's great. Setup, there would be a mannequin. You will be teaching this testicular examination. Again, you will have 90 minutes. Give a good time to the questions. Scenario, make up a map inside your head, and then go inside. Okay, greet, introduce, and then build rapport. How are you? How is your ward going? Are you learning new things? Is there any problem? What's the purpose? Understand that you are here to learn. Okay, so knowledge, what do you already know about? When do we perform testicular examination? What are the indications? So whenever there's pain, there's swelling, ulcer, warts, or any problem, UTI, or any problem down there, we perform testicular examination. It's done, 1.5 minutes have been passed. Now, go to the table, go to the mannequin. Again, same thing. If you're going for testicular examination, there will be a patient. So for the patient, you need to take consent brief. Okay, John, we are near the patient, so now we will explain briefly to the patient that we are going to examine his private parts. So we will take consent from the patient, and then we will ask the patient before proceeding our clinical examination. Just in 2 or 3 sentences, you have done with the first part. It would not take more than 10 seconds, but it would give a nice impression that he takes care of safety and he takes care of patients, or he or she takes care, yes. So the first part has been done. You have checked the name and date of birth, and you have, obviously, you are going to examine the private parts, the groin and testes. So a chaperone should also be there. It could be any ward member, ward staff member who would be present throughout the examination. All right, so now everything has been done. Now it's time to teach this examination. The first part is examination, inspection. Okay, it's relatively lengthy procedure. You cannot complete this whole procedure in 8 minutes. So what you are going to do to give maximum knowledge with the safety and kindness to complete in 8 minutes? Let's see how we can do this. So inspection is penis, groin, abdomen, scrotum, perineum. You will combine all the 5. And okay, John, the first thing is inspection. We inspect the penis, groin, scrotum, and perineum, and we look for any skin changes, scars, masses, swelling, and bruising. In 2 sentences, you have cleared the inspection part. You have cleared all these things. If you ask questions, what kind of scars? Then I have written down this: the inguinal region, inguinal hernia repair, aquapexy, or any surgery that has been done in the past. You can say these. And the masses, there could be a cyst, there could be hernia or lymphadenopathy, unstenotic testes. You can mention them. If he asks questions, if he doesn't ask question, just state that we look for skin changes, scars, masses, swelling, and bruising. Just headings. Now you are good with that, and now move for palpation. Now the important thing here is most of the time in practical scenarios and in teaching, candidates start palpating like penis and testes without verbalizing anything. You just say we're going to palpate. No. When you are going to palpate, you need and you have to ask the patient that if there's any pain, just let me know. If there's any pain, if there's, just verbalize it 2 to 3 times so that it looks natural. so that the examiner who is sitting there should understand that he is checking for why do we palpate? We palpate for masses, we palpate for pain, tenderness. So how are you going to check the tenderness if you're not asking if there's any pain? If because it's a dummy, and the patient is sitting there, and you are here, you are going to ask if there's any pain. Just let me know, John. So now he's a student. How to teach a student? Okay, Alex. So we will be asking patient that if there's any pain, just let me know. We will palpate first, palpate using meters, inspect the glands, and then test it. Mostly in testicular examination. And there's a technique, use both of the thumbs and index fingers and gently palpate the whole testicle, and then from the remaining fingers do this palpation. I will be showing you the video at the end of this lecture so that you can have a better understanding how to palpate testicles. And remember, always ask, is there any pain? Always ask for the pain. So that if there's any tenderness, if epididymitis or any other condition, if there's you have to do brand sign, then you can distinguish between them. All right, so now you are teaching. So okay, John, the first step is the palpation, and then if there is a mass, what we look for? John, can you tell me what we look for? Oh, don't worry. So we look for a size, shape, consistency, tenderness, flatulence, and if all these things are there, if there's a cyst, then we perform transillumination test. I will show you the video, and you will have the better understanding what the transillumination test looks like, and how do we perform. There would be a torch will be there in the exam. So if there's a cyst, you have to perform this transformation test. But sometimes they do not put the torch there, so you have to mention it. Cough impulse and the ability to get over ability to get over the lump. This is important thing. If you are not able to get over the lump, then it is possible that there might be a hernia. If there's a hernia, then you need to examine groin part as well. You need to examine abdomen as well, and you need to do the cough impulse while standing in position to rule out any hernias. Just mention. Just do not need to go into details, just mention. Then we palpate epididymis and spermatic cord. If there is pain, then we perform brand test, and it is a specific test that we usually do to distinguish or differentiate between testicular torsion and epididymitis. So if the reduction in the pain, then it is epididymitis, and if there is no reduction in pain, if the pain is the same, then it is testicular torsion. And then the cremasteric reflex, I think I forgot to write it down. Okay, then cremasteric, just mention it. We do cremasteric reflex, in which one of the testicles just move upwards. It is used for L1 and L2. Just mention it. Okay, so when you will be performing this testicular examination, you will almost take 8 minutes, because you have to perform both sides separately and palpate, then first inspection, then palpate, then you will be checking understanding, involving the patient, doing brand test and cremasteric reflex, then 8 minutes will be gone. Again, during palpation, whenever you're going to touch, warn the patient, ask him to report patient. Okay, one thing I forgot, before palpation, just warn again, like subcutaneous injection, you are going to inject, you just warn the patient. Again, in speculum, when you're going to insert speculum, you warn the patient. In testicular, when you're going to touch, you are going to warn the patient. I'm going to touch. If there's any pain, just let me know. It's just a thinking. Just make up your mind, build up your mind that every time you're going to touch, every time you're going to do anything, just warn the patient, just involve the patient as well. Okay, and at the end of the examination, ask the patient to stand up for the varicocele hernia. Mostly, dummy would be in standing position. And dummy would not be in laying down position. Do not touch, do not hold the urine in your hands and lie it down. Do not do this. Dummy should remain in its position. Do not change the position of dummy. You can just verbalize it. I would like to do all this, my examination in laying position as well, but you have to show this examination in standing position. I hope this clears. So they are important points. Again, consent. Do not forget to mention consent of the patient, chaperone, checking understanding of the student. Is there anything you are not getting it? Should I repeat it? No. Am I clear? Is there any ambiguity? When going to touch and palpate, inform patient. Thank and cover up yourself at the end. It's just simple. You are standing outside 90 seconds, enter, greet, introduce, repo, purpose, knowledge, consent from the patient, chaperone, and then if you have any pain in the testicles right now, before examination as well, because in epididymitis there would be a pain. There is a scenario, there is the patient with mumps or orchitis as well. Yes, there is a pain. In mumps or orchitis, there is a pain. So if you are teaching, you will ask the student that if there is, ask the patient before performing examination if there is any pain. Now start examination, inspection, then palpation. Before palpation, I'm going to touch. If you have any pain, just let me know. During palpation, if there's any pain, just let me know. John, are you fine? Tell the student that during palpation you are going to palpate. You're going to check for the pain. And then Brand test, cremasteric reflex, and then last, cover up yourself and thank the patient. There are a few tests like transformation test. You can do it in the palpation part. Okay, and for the video, I will be showing this testicular video after doing all the scenarios. Then I will be sharing testicular, Epipen, and if I find any other good videos, then I will be sharing with you. So let's move on to the other scenario, which is abdominal examination. Again, these two are similar examinations. Testicular examination, abdominal examination. These are examination approaches, 100% same. You are FY2, you are in general surgery, medical student, and abdominal examination. You have to teach a medical abdominal examination. Grapes, repo, purpose, check knowledge. When do we perform this? When patient is having this abdominal pain, he's not feeling right, he has not passed poo for a while, and if there's a scar, if post-op, pre-op, there are a number of indications for abdominal examination. Okay, remember one thing. You cannot complete abdominal examination in 80 minutes at any cost because it's too long. So you can add one thing in the beginning while giving the knowledge to the patient, to the student, that abdominal examination is lengthy. We might not be able to cover it in one setting, one meeting. If there might be possible that we cannot complete it, but if you're interested, then we can arrange another meeting and we will complete abdominal examination. Just for the sake that the examiner should know that it's a longer examination, we cannot teach it in one sitting. Again, confirm name, date of birth, explain in patient-friendly manner, take consent from the patient, and exposure and ask for any pain. Okay, if you are exposing private parts, then there should be a chaperone. If no, then there's no need for chaperone. Again, start with inspection, similar like testicular, go to one end of the bed. Just in this abdominal examination, this mannequin would be laying down. So again, do not touch the mannequin, it would be in laying down position. Then inspection starts from the hands. What you can do, because the mannequin doesn't have hands. The mannequin should be like this, should be like, let me show you the mannequin, same like the BLS one. The mannequin would be the same. This would be the same for it would be slightly longer than it. There would be an abdomen. It would be the same. So mannequin doesn't have any hands. How you're going to show that you are going to check it? You are going to use your own hands. Okay. Okay. So you're going to use your own hands. So John, these are my hands. First, you're going to examine the hands of the patient. What do we check? We check for paler edema and nails and finger clubbing and hysteresis. You know, how do we check hysteresis? We ask the patient to just hold his hands, stretch the arms like this, and if there are any, we check for any tremors, if the movements, then that's how we check the hysteresis. Just involve the patient. This would take almost 30 to 40 seconds or 1 minute. For the hands, you can mention about colonacia and euconacia. Then abdominal examination. In abdominal examination, it starts, I do understand it starts from the hairs, from the eyes, and we check the tongue as well, but we do not have time to do all these things. The best thing we can do is we can verbalize it. Okay, John, after hands, we check hairs, we check eyes, and then tongue, and then we move on to abdomen. Okay, for the abdomen, the first step is inspection, similarly testicular. What we see for scars, abdominal distension, caput medusa, stria, and surgical scar mark, or there are certain signs like Cullen signs or Burton signs. You do not have to mention all these things. Just keep it simple. We look for scars, distension, and any abnormalities, surgical scar marks, or any rash. These are the most common things. You can just say, just mention those things. Then prepare, it's just simple, wash your hands and wear gloves. It will be written on the wall that assume you are gloved. Light palpation, in the light palpation, there are 9 quadrants. You can tell John that there are 9 quadrants. Do you know what are the 9 quadrants? Yes, they are the left hypochondrium, epigastrium, right hypochondrium, umbilical region, right flank, left flank, and so on. There are 9 quadrants. We have to first lightly palpate it and then deeply palpate it. You know, these show the student that you are going to palpate, and that's how we are going to palpate. Just check all the quadrants for tenderness, seaborne tenderness. Just cover light and deep palpation in one sentence. We check for tenderness, we check for any masses. If there are masses, we look for size, shape, consistency, mobility, and pulsatility. So you can cover in one sentence, like in one go, about light and deep palpation. Now comes the palpation of liver. You all know how to palpate the liver. I have written down the technique that ask the patient to deep breathe and just show the student that go palpation moving 1 to 2 centimeters superiorly from the right iliac fossa and get close to the costal margin. Just verbalize these steps. And then Murphy's sign, important sign. What we look for it, we look for cholecystitis. If Murphy's sign is positive, it shows that there is an infection in the gallbladder called cholecystitis. So it's a diagnostic sign. Palpate spleen, you can mention it and you can perform it as well. Then palpate aorta, you can put your 2 hands like this and palpate aorta and abdomen. I'll be showing the video as well. You can have a better idea. Yes. Then percussion. Percuss the lever. You have to measure lever span as well. Then percuss bladder, abdominal auscultations. Then listen to bruise. And again, I understand that this cannot be done in 8 minutes. But what they are looking for, they're looking for safe doctor. What are the features that makes you safe doctor? Explain to the patient, taking consent. When you are going to touch, taking permission. When you are going to palpate abdomen, take permission. Alex, let me remind you one thing. When you are going to palpate abdomen, you need to take permission from the patient. I am going to palpate your abdomen. So, and continuously you are going to ask patient if there is any pain while palpation or palpating abdomen, and look for the eye, look for the face for any pain, because many doesn't have face. You just have to verbalize. Just mention it in your consultation that we will look for look to the face for any pain. So these things comes in the safety. You need to cover these things. They understand that abdominal examination cannot be done in one sitting. So should show them that you are a safe doctor, and chaperone, obviously, if you are examining groin region. So again, abdominal examination is simple. your task outside, enter into the room, greet, repo, purpose, knowledge, taking consent from the patient, and then briefly explaining, and then asking for the pain before the examination, starting examination, inspection from the hands, so your hands, and then inspecting abdomen, asking for the pain when you are palpating, and then taking permission from the patient that I'm going to touch, and then liver span, spleen span, and then at the end bruise, and listen to the abdominal sounds. Let's move towards our second last station, that is Epipen teaching. And you are same. You are what you are ever to in GP. A student nurse wants to learn Epipen. So let me show you what is Epipen. This is Epipen. Okay, this Epipen has adrenaline in it. It is specifically used for the patients who has anaphylaxis, reaction. So you just inject it when you are just having symptoms of anaphylaxis. What are the symptoms of anaphylaxis? It is lightheaded or faint, breathing difficulties, wheezing, fast heartbeat, clammy skin, confusion, anxiety, and something is coming to the throat, shortness of breath. These are the symptoms of anaphylaxis. So the patients who have been diagnosed with some kind of allergies, all the patients have these EpiPens, and whenever they experience those symptoms, they just put this EpiPen in their thighs for the adrenaline. So now this is coming in teaching scenarios. Previously, it was coming like this: explain this EpiPen and how to use it to the patient. But now it's coming in teaching scenarios as well. So we opt for it. We will see how we can teach student that how to use Epipen and how to inform the patient that how to use it. So let's see. Setup. There is a table and there is a dummy Epipen. This is dummy Epipen. They do not have really real adrenaline. They are just for the learning purposes. Again, you have spent good 90 seconds outside your cubicle. You enter, greet, introduction, build rapport, purpose, and you have checked the knowledge. Do you know, Alex, what is Epipen? Epipen is an instrument, is a device that contains adrenaline in it, and it is auto-injector, and it is used in anaphylaxis. Just in two sentences, it's covered. Now, overview. Provide a general overview to the patient. Adrenaline auto-injector. It is prescribed for allergies, having recent severe allergic reaction. Now you are teaching student that, okay, John, it is prescribed for allergies, and it is used to give adrenaline, and this is what injector looks like. Hold the EpiPen in your hand and show it to the student that it is the injector looks like. And what are the features? There is a blue cap. The blue cap on one end, there is orange cap on the other end, and there is a visible window, viewing window. From this, okay, for the abdominal examination, let me tell you that if you are teaching, you have to verbalize it. If you are not teaching, then you do not have to verbalize it. There are two separate approaches. In teaching, you have to verbalize because you are teaching to a student. However, in other examinations, like in Meek syndrome, there is scenario, the combined stations. When you are performing abdominal examination, then you do not need to verbalize steps. However, in teaching, you have to verbalize steps. These two are separate approaches. Remember, in teaching, verbalize. In combined stations, do not verbalize. I hope this is. All right. So we were discussing about EpiPen. This is the viewing window. You see either fluid is clear or not. If fluid is not clear, then it shows that it has been damaged and it has been expired. You need to change it, and there is expiry date as well. So these four things, these are four features of Epipen. Below safety cap, that's there. can see it. And viewing window, there is the viewing window. This is the viewing window, this brownish in color. So insurance, it is clear and colorless. Should be clear and colorless. If it's not, then there is a need to change. Okay, then there is expiry date. You need to check on the expiry date would be expired on the other side of the Epipen. And there is the orange piece, needle cover. There is a needle. This is the orange piece. There are 4 features: a below cap, orange needle, viewing window, and expiry date. All 4 important for safety features. These are safety features, of course. When to use Epipen? Epipen should not be, okay, when you are having severe allergic reactions. Okay, John. So now comes, these are safety features of Epipen. So when we ask the patient to use Epipen, when they have severe allergic reactions, and we know when there are severe allergic reactions, there are certain symptoms. And these symptoms are lightheadedness, faint, breathing difficulties, wheezing, fast heartbeat, clammy skin, confusion, and everything. These symptoms have been mentioned there. And okay, all right. So now the procedure. Now you have explained the student that what are the features and what are the symptoms when to use Epipen. Now the procedure, your main task. Before using Epipen, check the viewing window expiry date. Again, safety features. You have to see viewing window and expiry date. These 2 things are important. After checking these 2 things, you have to administer. There's the beautiful, that's the good picture that shows there, yes. Okay, this is a very good graph. Pull off blue cap first. First, you have to pull off, it's for the safety purposes. First, pull off the blue cap and position orange end 10 centimeter away from the mid thigh. This this line, a phrase that is used: blue to the sky and orange to the thigh. You know, thigh, the orange should be towards the thigh, and blue color should be, or the cap, the other end should be the sky. You hold like this. You will be teaching student like this. Okay, John, there is a phrase called blue to the sky and orange to the thigh. So, you know, hold Epipen in your right hand or in dominant hand like this, so that its blue cap should be upward and orange towards thigh. And then in a swinging motion, just put it on your thigh. It can be given on the cloths as well. And start counting 1 elephant, 2 elephant, 3 elephants till 10 seconds, so that the maximum amount of adrenaline should be injected. 1 elephant, 2 elephant, 3 elephant, 4 elephant, so on. After 10 seconds, you have to remove it and the needle itself goes away. This is the proper explanation in 4 steps. First, pull off the blue cap. Second, hold Epipen in your dominant hand, blue to the sky, orange to the thigh, and in swinging motion, just put it on your thigh and count 1 elephant, 2 elephant, 3 elephant, 4 elephant, and just until 10 seconds and remove it. The needle will go inwards on its own. And remove the Epipen on your own, and ask the student that usually the patients with anaphylaxis have 2 Epipens. So ask the patient if the symptoms are not relieved, you can inject your second Epipen after 5 to 10 minutes and call 999 for the ambulance and make a position which is lie down and with your legs slightly raised while waiting for the ambulance. That's simple. And take your used Epipens or expired Epipens with you to the hospital so that these Epipens can be replaced. There's a proper website for the Epipens. There you can check the expiry date as well. The data has been they document everything. Okay, the patient should be given general information. This is a general information that you tell the student that you should give to the patient, that there should be 2 Epipens. Inform workplace and about the allergies and your family and friends, and make sure you not leave hospital without replacement. Check if the student has any questions regarding Epipen when you use it. It is a small station. People usually cover this station in 5 to 6 minutes or 7 minutes, so don't worry. It's for all of them. So you just have to show the safety features. If you are following those safety features, you will pass. Okay, so again, let me summarize. You have this scenario outside the cubicle. You enter into the room, greet, introduce, build rapport, check state purpose, check knowledge, and then go towards the EpiPen, show the EpiPen to the student that this is the EpiPen. There are 4 features: blue cap, orange end, viewing window, expiry date. Don't forget these 4 things. And then there are general informations that these are 4 features. And then before administering, you have need to check 2 things: viewing window and expiry date. And procedure, there are 4 steps. The simple 4 steps. First step, just blue cap, remove the blue cap, blue to the sky, orange to the thigh, 1 elephant, 2 elephant, 3 elephant, 4 elephant, remove it. After 5-10 minutes, you can give you a second EpiPen, but before that, call 999 for the ambulance, lie down and raise your legs. That's simple. Just check understanding and involve student. So John, do you have any questions? Just let me know if you have any difficulty. So if it's not written outside the cubicle that do not tell the student perform, you can give the EpiPen to the student. Can you please, John, repeat it for me, how to inject EpiPen? Because it is a dummy EpiPen, it will not harm. There is no adrenaline in it. That's great. Okay, I will be showing you the video as well. This is a very good video at the end of this last station. This is our ECG teaching. This is also coming nowadays. It is a new station. It's like it's coming for 1 year, for the last 1 year. So I will be discussing about it quickly. What you are about to in acute medicine. Okay, so where acute medicine, second year nursing student on rotation. Now, most of them would be on rotation. So it would be easier for you to build a rapport. How's your rotation going? Learning new things. Is there any problem? I can help you. Are your exams coming? I can help you with that as well. Okay, what is your task? Explain how to perform ECG. Okay, sorry, would like to learn ECG and knows how to perform ECG. So this is the good thing, that it has been written outside that he knows how to perform ECG. And he's just is just here to learn ECG. Okay, remember one thing: if it's not written here, he knows how to perform ECG. In the knowledge section, you can ask him. Okay, well, Laurie or John, whoever he is or she is, you can ask, do you know how to perform it? If he says yes, then go on. If he says no, we will arrange another meeting. So we will I will let you know how to perform it. But now our main task is learn ECG, how to learn ECG. So you can just mention that you have asked about the how to perform ECG as well. Okay, you have spent your good 90 seconds outside the cubicle. Now you enter. Your setup would contain pen and paper. So this also comes in there are 2 approaches I will be telling you after a while. Again, grips, greet, and smile, be confident. Hello, John. My name is Janil. I am one of the F2s. How are you? How is everything? How is rotation going? Do you have any problems? And I understand that you are here to learn ECG. What do you already know about the ECG? That's great. And do you know when we perform ECG? It's the bedside procedure. We usually perform in emergency, we usually perform in ward, we usually perform pre-op assessment, and we have a number of occasions. It gives initial assessment of the heart. And just in 1 minute, just familiarize with it. Now again, okay, when you are teaching student that what is ECG, they would be pen and paper. You just verbalize it. Before I continue teaching you, you have to confirm name and date of birth of the concerned patient, and the time and date the ECG was taken, and the calibrations of the ECG. Before reading the ECG, just mention them. And there's another scenario in which there is ECG. The student will be holding an ECG, and I will tell you how to approach that station as well. But for now, we are going with a station in which there is a pen and paper. So after these two questions, you can start with, oh, okay, John, what is normal heart rate? It's 60 to 100, that's great. And if it's above 100, it's tachycardia, slow, less than 360, it's bradycardia. And how do we calculate the heart rate? You can make QRS complexes on the paper, and then you can help him to calculate heart rate. Meanwhile, you can tell him about the big boxes and the small boxes as well. You can tell about the small boxes, it contains it is of 0.02 seconds, and big boxes of 0.4 seconds, so that he might have good understanding of how to calculate rate. So go on. Okay, it is for you people that make up a map in your mind that you are going to teach ECG. There are 3 to 4 things that are important, because in 8 minutes you cannot teach more ECG. First is rate, then rhythm, then axis. You can cover 8 minutes. You can cover these 3 things in 8 minutes. Okay, easily. Then if the rhythm is regular, then how do we calculate the rhythm? We calculate number of QRS, number of big boxes into consecutive 2 QRS complexes. Like in this picture, there are 1, 2, 3, 4. There are 4 large boxes. So we divide 300 by 4, 75. Yes, a small box is 0.04 and big box 0.2 seconds. Okay, so that's how we calculate rate. We divide these large box, big boxes with 300 for the whose rhythm is regular, normal rhythm. For irregular rhythms, we calculate QRS complexes in 30 big boxes or throughout the ECG. There are 2 approaches. I am coming to that approach as well. In one scenario, there is only pen and paper. In another scenario, there would be an ECG that the student will be holding an ECG. Student will give you the ECG of atrial fibrillation of MI. So there are 2 approaches, 2 different scenarios. So we will be discussing it also. All right. So this is the approach of pen and paper. There might be possible that when you are teaching the student in a pen and paper, you can, if you ask the patient if you have any ECG, then he might give you some ECG. There is a possibility in the middle of the scenario, but initially there would be only pen and paper. So for the irregular, I have made all these lines, and you can calculate QRS complexes in 30 big boxes and then multiply it by 6 and 60 beats per minute. This is the way everyone knows how to calculate rhythm, and they are regular, irregular rhythm, then cardiac axis. You can talk about normal axis, about the leads. They are lead 2, which is most positive in normal cardiac axis, and right axis deviation. Lead 1 should be negative and 2 should be positive. There is the thumb rule as well. You can use thumb rule as you can teach student by a thumb rule as well. And there's left axis, whatever you might feel that it's easy for you. Left axis deviation, there's the lead 2 and 3 are negative. So there are P waves. You can, if there is no P wave and rhythm is regular, then it could be atrial fibrillation. You can mention about flutter waves, fibrillation waves, and about PR interval. There's a 1st degree heart block, AV block, and 2nd degree heart block, Mobius type 1, Wenke braking. There is a progressive prolongation of PR intervals, and there is a skip rate in 2nd degree heart block type 1. In type 2, the PR interval remains constant, but there is a skip beat after 3 to 4 QRS complexes. And the 3rd degree heart block, there is no correlation between P and P waves and QRS complexes. So in this way, you can teach ECG. You can check understanding after rate. Is there any problem after rhythm? Is there any problem? Just let me know. Should I repeat the rhythm? Should I repeat the axis, the PR, if heart blocks? If you have any ambiguity, just let me know. This is one approach when these are pen and paper. Okay. Previously in March or April, this station was like that. When you enter into the room, after in a scenario, there would be a student that will be excited, and that would be he would be having ECG in his hands, and he was just like waving ECG in his hands, and he would be excited. He was saying, "Doctor, I want to learn this ECG. I want to learn this ECG." It has been happened like 2 to 3 times previously as well. So just prepare for that. Now, what is your responsibility? Being a doctor, you should act professionally. You should not act excitedly in front of the doctor that, okay, I am going to teach you. No, don't do this. Just act professionally. Okay, John, calm down. I am here to teach you. I will just teach. We will go through the initials, and I will teach you. Just calm down. So that is the way that the student will be having the ECG. And then you start teaching again rate, rhythm, about axis and heart blocks on the ECG that is given by the student. And in another scenario, in the half time, the student will give you the ECG. Now, if you ask the student, do you have any ECG? He will give you ECG of atrial fibrillation and or MI. So you are a doctor. Now there comes the safety point. You see an ECG of atrial fibrillation. Okay. So you will ask the student, have you taken permission from the nurse staff for this ECG? Like you cannot take any document without any permission. So ECG is also document. So have you taken permission from the nurse? One thing. Second thing, how is the patient now? Obviously, there's the MI patient. He's a second-year student nurse. He might have taken this ECG from an emergency department. Patient is there and he's here for teaching. This shows that you are safe doctor. How's the patient? Do you know what is the condition of patient? So in every case, the student would say that the patient is stable. I have taken the permission. So you have to add 2 to 3 lines before teaching the ECG, so that you show that you also care for the patient as well. The patient is coming with MI, and student is showing you the ECG of MI, and then explain same rate, rhythm, axis, and heart blocks. There are certain questions: what are PVs, what is heart block, and what do I need to look for it? Again, outside the cubicle, good 90 seconds, enter, greet, introduction, rapport, purpose, knowledge, and then start teaching ECG paper. And if the student is excited, calm down, you are professional. And if he shows ECG in middle of the scenario, ask from where did you get it? Did you take permission? How is the patient? 3 to 4 questions shows you are a safe doctor. So that's the end of the second day of this extensive course, and I hope everything is clear. If you have any questions, you can ask me, and I will post some videos as well. For the Epipen teaching, there is a beautiful video. Just in 1 minute, I will find a video for you. Video there. Yes. Watch this video of Epipen, you will have better understanding. That's a great video. Okay, so there are 2 questions. No. After 30 seconds, there is a 30-second time for the glucose. You do not wait for 2 minutes. After you will start when you will place the strip on the paper towel, you will start the stopwatch, and after 30 seconds, you will like 25 seconds, you will hold a strip in your one hand and start comparing it with the container. Like I have shown you the picture. Let me show you the picture of urine dipstick. Okay. This is the container and this is the strip. Just hold it on at 30 seconds, show it to the student that I'm going to check the glucose levels. So you start with 30 seconds, not with 2 minutes or 2 minutes. Yes, sure. You can write it right on the ECG. If you have a pen, then you can write. If you have a pen, then obviously you can write on the ECG. If the student shows the ECG, you can write on the ECG. If there is a pen, if there is no pen, then you can just verbalize it. But in most of the cases, there is a pen, so you can use that ECG as well. If there's the papers, you can use the paper as well. So there is no harm in that using the ECG provided by the student. Okay, and for testicular examination, let me share another video. This is a good video for testicular examination. Please watch it and just note down that what are the safety features, how they follow the safety things, and how you are going to show that the examiner that you are a safe doctor. Okay, I hope everything is clear. If you have any questions, you can post. Now we will be taking a 15 minutes break. We will be back at 8:10. And we will practice some scenarios and we will see how we are going to do this. We'll be back at 8:15. Okay, I have recorded this video. I will post on the channel. Thank you.